One of the most common things that we get called about is when someone's woken up with their neck and upper back stuck, what we might call a torticollis, or people might describe as a pinched nerve or an acute neck spasm. Whilst we can often help by having a look, diagnosing and doing some treatment, in many cases just the right self-management can really help you through those first few days, and often they will settle as soon as they come. Even though it feels like everything's stuck and spasmed, a lot of the time the biggest issue is due to swelling of the joints, muscles next to the nerves, which is very sensitive in the neck, which is why you get such a big reaction. So although it's counterintuitive when you're stuck, using ice packs on it, wrap it in a damp tea towel so you don't burn your skin for about 15 minutes every hour or two can really help bring the swelling down. And if it's okay for you to take in terms of safety, some over-the-counter ibuprofen or anti-inflammatories can also be helpful to get the swelling down, and that'll help the injury recover quickly. Also good just to very gently keep moving, changing positions regularly, not being in one position for too long. And in terms of any exercises, actually we don't want to sort of pull and prod with heavy stretches or loading when it's trying to settle, but one quite effective exercise for pain relief, as well as just helping you through that early stage, is some gentle isometrics or pushing against resistance exercises. To do that, we would simply come up into a nice upright position and we would hold our palm on our forehead and just push gently into your palm, like you're trying to nod your head forwards, but the palm will stop you. When you're quite sore, that can just be as little as like a 20 to 50% max effort. And as things settle, you can push a little bit harder against the resistance. And we're looking to hold that for a good 20 to 30 seconds if you can. And we're going to repeat that with the other directions as well, pushing back, pushing to the side, and pushing to the other side. That can be quite good for pain relief, like we said, and can also just be something you can do to help nurse it through those early stages. If you were still feeling quite considerable pain and spasm 72 hours or even a few weeks later, definitely that's the right time to perhaps contact a professional for an assessment and some help.